Okay, so this is my postpartum assessment on my mother. This is gonna be my my mother for today. So before I went in, I would knock on the door, hand hygiene, and I would go in and introduce myself saying, "Hi, my name's Olivia. I'm gonna be your nurse today. Is it okay if I do an assessment on you?" And then they would say yes, and I would tell them I am going to examine your breasts, examine your fundus, listen to your bowel sounds, check for edema, and all of that. And so I would sit her up in bed and I would check her IV site. I would check for like any redness, if there was like any saline buildup or anything like that, the meds weren't flowing through, irritation and all of that. And then I would go in and look at her skin color. It would be pink or normal for their ethnicity. They're oriented because I'd be having a conversation with them, and that's how I know they're oriented ×4 and all of that. And so so they're sitting up in bed, I would then go to their breasts and I would examine their breasts. So I would palpate for softness, any tenderness, any like bumps or anything like that in there, any like tumors or anything abnormal for them. I would then look at their nipple to see if it was flat, everted, or inverted. The best kind of nipple to have when breastfeeding is everted. I would then further and ask them, are they bottle feeding or breastfeeding? If they're breastfeeding, then I would ask them how the baby's latching, if it's going well, if they're seeing any colostrum, which is their new milk coming in. And then if they are breastfeeding, then I want to assess their areolas, check for any like blistering, cracking, redness, or anything like that, because if there is any redness or bruising or anything abnormal like that, the baby could not be latching on right and just grabbing just the nipple and sucking too hard, which is like irritating it. You want to make sure that and then I would inform them saying, okay, I'm going to come in next time that you breastfed, because I don't think the baby's latching on right. It's just grabbing the nipple. You want the whole areola. And then I would ask that they give themselves regular breast exams. Normally, if you do that, they're going to like lift up their arm and say, yes, like I'd start here in their lymphoid area. And then from there, if they don't, then I would tell them that they should be giving themselves regular breast exams, that it's important to do that to check in for any abnormal breast tissue or anything like that, and to palpate their breasts. Normally, like they can do it in the shower and to do it before their period starts, like a week before. I would then go down and I would lay them back in bed, so then I get their whole stomach all relaxed and flattened out. I would assess for their fundus, so I would put my hand underneath their pubis symphysis and feel above or right around their umbilicus cord, or their umbilicus area. And I would palpate for the fundus height. So normally it should be right in midline and it should be firm. So then I would then go and ask them if they massage their fundus, if they know how it feels, and to tell them that it should feel firm. And if it felt like soft or boggy, that they should massage it, but not to massage it too long, because then it will then go back to like feeling boggy and all relaxed. You want it to be firm and tight, because that's the uterus contracting. And then from there, I would ask if when their last bowel movement was, let's just say it was a couple of days ago, I would make sure that that was normal for them. If it wasn't, then I would probably want to go and give them like a stool softener for them, because they could be on pain medication that could be making them constipated. And then I would ask them the last time that they went to the bathroom, if they urinated, and if they had any burning or they're constantly going to the bathroom, because that could be a sign of a UTI from the Foley. So then also, before I would have palpated, I would have listened to their bowel sounds, and in all 4 quadrants, made sure that the bowel sounds were active because most women have an epidural from either just delivering vaginally or their C-section. So moving on from there, I would assess their incision line from either their C-section or their episiotomy if they deliver vaginally. So they did have a C-section, I would assess their incision line, checking for any like redness or swelling, edema, or anything like that, making sure there's like no drainage, like signs of infection. And then I would go down and look at their episiotomy, see if same thing, redness, edema, swelling, or that is swelling, edema, and any signs for infection, because sometimes for like diabetic patients, they don't know, like their healing process is different, and so they could get infected, and we just want to keep an eye out for that. While I'm here, I would ask for how many times she's been changing her pad out, to see like her normal bleeding process, because sometimes some women, after they deliver vaginally, their bleeding is different. So you just want to ask them, is it like your period? Is it heavier than your period? Is it lighter than a normal period? And then I would check the pad myself to see if it's scant or moderate. And then also ask if they have any clots when they went to the bathroom, or they noticed any clots in their pad, like the size of a golf ball. And if they have, that they need to, I mean, we would be there now. So if they haven't had any, that's great. But if they do notice any clots, to inform us, because that could be something very serious. They could be hemorrhaging inside and they don't know that, or they could have like a placenta still, like part of their placenta still in there. So it's something that we would need to inform them on. And then after assessing their bleeding and their lochia, to then, after I would educate something on that, but then I would go down and I would look at their edema on their legs, if they had any, and then to see and ask them if they've had any like pain in their leg. I would feel for warmth and stuff like that, because it could mean that they have a DVT, and that is something that is very serious and that we need to report to the doctor right away. And then after my assessment, I would sit her back up, and I would then inform her on postpartum blues or depression. And if it was their first kid, I would ask if they've had depression before, because if they have, they might experience some postpartum blues, which is something that is totally normal and that most people go through after they have a baby. It's just all the hormones, the decrease in hormones drastically. And then if they have depression before that, if they end up having depression for like their postpartum blues last for more than 14 days, that they probably have postpartum depression now, and that they need to report that to their doctor right away and seek treatment. But usually it goes away pretty soon after delivery. And then if it is like their second kid, to see if they've had postpartum blues with their last kid, because it could happen again, and just remind them that it's okay and all of that. And then just check for their lochia, keep an eye out on that, if they have any like dizziness or headaches, their bleeding increases, and they have any clots the size of a golf ball. And then I would lower the bed, put them back to normal, and then ask them if they had any questions or concerns, and if they have anything later on, to just make sure they let us know. And that is how I do a postpartum assessment on a mother.